Going in depth today, the Navajo are the largest native nation in the United States by population and by geography. The reservation itself spreads across parts of New Mexico, Arizona, and Utah. About 174,000 people live on the tribal lands themselves, with a little fewer than half again living outside of the reservation. They have lost close to 1,000 residents to COVID-19. To put that in perspective, that's more than 10 times Utah's death rate from COVID-19. This is despite severe lockdowns and other health orders that have been put into effect by the tribal government, taking it very seriously all the way along. Well, now the U.S. Navy says they are going to step in and try to help get the numbers under control, help with vaccination efforts, and we are honored to be joined right now this afternoon via Zoom with our special guest to help us go in depth on this, President Jonathan Nez of the Navajo Nation and Dr. Jill Jim, who's the Executive Director of the Navajo Department of Health. Glad to have you both here. It is an honor. And first of all, tell me if there's anything that I said that was wrong or anything else you want to say about the COVID situation there on the nation.
Yeah, I think so. Well, thank you for having us, Max. Jonathan Nez here. You know, the Navajo Nation has been hit hard by this virus, and we're doing everything in our power to keep our Navajo people safe. And we have also received vaccinations from the federal government through the Indian Health Services. So over 57% of what has been received from the federal government in terms of shots have gone into the arms of our Navajo citizens. So there is some light at the end of the tunnel here for the Navajo Nation. And we also appreciate all the support that we've been receiving from partners from all over the country. And we have had people who have volunteered their time, the federal government bringing in some of their healthcare professionals when we were at the highest point in COVID positive cases. So we want to say thank you to the Department of Defense and the Department of Health and Human Services and many others who have supported us through these trying times.
Have you been getting enough support from our state? You know, you're talking to the people of Utah right now, and this has really brought home, I think, to me, and I'm sure to a lot of us here in Utah, that we maybe don't know enough, don't pay enough attention to our fellow Utahns on the Navajo Nation and our neighbors in the adjoining states as well. What can we do to help, and is Utah helping enough?
Yeah, and I appreciate the former governor, Gary Herbert, for his advocacy for the Navajo Utah residents, as well as the new governor, Spencer Cox, for bringing resources and, of course, the vaccines to the Utah Navajo health systems. And so we're appreciative of that partnership. You know, Dr. Jill Jim here, she is our one of our cabinet members for our administration. She is the executive director for the Department of Health, and she is also a Utah resident herself, and she's been working directly with the state of Utah as well.
So, Dr. Jim, in terms of that relationship, and also, I wonder if you can address that, but also, why is it that the death rate is so much higher? 27,000 and some reported cases, and almost 1,000 deaths. That's several times higher than the death rate that we're seeing in Utah. What can we do to help to bring that down? Why is that the case?
Well, I think not only is the death rate higher, it is also probably seen in other health populations like African Americans. So definitely other minority populations are experiencing similar death rates. But of course, with the American Indian population, there's a lot of underlying health conditions. And we also are trending with those that are older as well. So putting that together, I think, puts us at risk for higher mortality rates. And I think in the future, I hope we can find out ways to identify those disparities that we're talking about. But things that we can obviously see might be just some social economic conditions. Our healthcare system is doing its best that we can, but at least with the assistance that we have from the state and national entities, we're preventing from our system becoming overwhelmed. So right now, that's the assistance that we can do, and also just to support the public health emergency orders that are on the Navajo Nation with visitors coming onto the Navajo Nation or even going off to the Navajo Nation. We do have a large population in the urban their area in the Wasatch area as well. So just knowing that we do have a population out there to serve their needs. And we do understand that the Utah Department of Health is providing vaccine allocations to the Urban Indian Health Center and also the Sacred, I think there's one other location there in the urban area to support our population, not only the Navajo population, but the American Indian population from Shoshone and Paiute as well. So just understanding how do we reduce healthcare disparities and access is probably a goal to provide more resources, not only in the southern part of the state and also the Wasatch area and across the entire state as well.
All right, Dr. Jill, Jim, and President Jonathan Nez, an honor to talk to you both. And I do want to say, I want to make sure that I'm right about this. Is that Window Rock directly behind you, in between the two of you? It's such a beautiful place.
This is our nation's capital. Yes.
Yes, I love your lands down there, and we're grateful for this conversation. I hope that we can continue it. Thank you for joining us.
Absolutely. Have a good day, everybody, all your viewers.